Welcome to Pamila's Healthcare Learning Hub. Mpox. Monkeypox. Introduction. On 14th August 2024, the World Health Organization (WHO) declared the outbreak a public health emergency of international concern (PHEIC) under International Health Regulations 2005 (IHR). This is the WHO's highest level of global alert, and the decision recognizes the potential threat this virus poses to countries around the world. The declaration focuses international attention on acute public health risks that require coordinated mobilization of extraordinary resources by the international community for prevention and response, future outbreaks. Discovery and history. Monkeypox virus was discovered in 1958 when two outbreaks of a pox-like disease occurred in colonies of monkeys kept for research. Despite being named monkeypox originally, the source of the disease remains unknown. Scientists suspect African rodents and non-human primates, like monkeys, might harbor the virus and infect people. The first human case of Mpox was recorded in 1970 in what is now the Democratic Republic of the Congo. In 2022, Mpox spread around the world, usually linked to travel or to animals being imported from regions where Mpox is endemic. The World Health Organization renamed the disease in 2022 to follow modern guidelines for naming illnesses. Those guidelines recommend that disease names should avoid offending cultural, social, national, regional, professional or ethnic groups and minimize unnecessary negative effects on trade, travel, tourism or animal welfare. What is Mpox? Mpox, formerly known as monkeypox, is a viral disease that originates from the monkeypox virus, which is part of the orthopox virus genus, related to the variola virus, which causes smallpox. It was renamed to avoid stigmatizing and misleading terminology. Types. There are two types of Mpox, Clade 1 and Clade 2. Clade 1 usually causes a higher percentage of people with Mpox to get severely sick or die compared to Clade 2. Mpox can be more severe in some people, including children, pregnant women, and those with weakened immune systems. Incubation period. Typically 7 to 14 days after exposure, but it can range from 5 to 21 days. Early symptoms: headache, fever, chills, exhaustion, muscle aches, backache, swollen lymph nodes, rash. Appears usually 1 to 3 days after the fever starts. Begins as flat lesions that progress to raised bumps, then fluid-filled blisters, and finally crossed over. Rash often starts on the face and can spread to other parts of the body, including the arms, legs, palms, and soles of the feet. Transmission. Direct contact. Contact with infectious body fluids, such as pus from lesions or blood. Contact with contaminated materials, such as bedding or clothing. Respiratory droplets. Though less common, it can spread through respiratory droplets during prolonged face-to-face contact. Animal to human. Contact with infected animals, such as rodents or primates, can transmit the virus. Human to human. Through close contact with an infected person's lesions, respiratory droplets, or contaminated objects. Diagnosis. Clinical diagnosis. Based on clinical presentation and history of exposure. Laboratory tests. The preferred laboratory test for Mpox is detection of viral DNA by polymerase chain reaction, PCR. The best diagnostic specimens are taken directly from the rashed skin, fluid or crusts collected by vigorous swabbing. In the absence of skin lesions, testing can be done using swabs or the throat or anus. Testing blood is not recommended to confirm the infection. Antibody detection methods may not be useful as they do not distinguish between different orthopoxviruses. Differential diagnosis. The disease should be differentiated from smallpox, chickenpox, and other rash illnesses.